Good morning, everyone. Welcome to the Positive Life Digital Health Community Consultation Forum. My name is Jane Coster, I'm President of Positive Life. I'd firstly like to acknowledge the Gadigal people of the Eora Nation and pay my respects to their elders past and present. Always was, always will be Aboriginal land. I'd also like to acknowledge any other Aboriginal and Torres Strait Islander people who are here today and pay my respects to their ancestors as well. I'd like to extend a warm welcome to you, particularly for coming out on a Saturday morning and giving up part of your weekend, for what we believe today is going to be a really important, informative, engagement and consultative process for our members, but for all people living with HIV in New South Wales. By 2018, every Australian, including people living with HIV, will have a My Health Record account set up by the Australian Digital Health Authority. This My Health Record account centralises all your health information so it can be accessed by your healthcare providers like doctors, specialists and hospital staff. It's been touted as one of the biggest advances in the Australian healthcare since Medicare. The My Health Record expansion and rollout has already started in limited areas, and it's critical that people understand this is an opt-out system, not an opt-in system, and the ramifications that this could have for some members of our community. There's been a lot of talk recently about data security, and we've already seen health data being shared for purposes other than primary use. Health data is, just yesterday, the ABC, you may have seen it, and a couple of people have pointed it out to me this morning, actually published a really good article on My Health Record and healthcare generally. So this is a really timely discussion to be having. I'd like now to hand over to Craig Cooper to provide an outline of what we're going to go through today, to facilitate a general discussion around people's initial thoughts and impressions around My Health Record, in particular regarding the privacy of our health data. Thank you.
Thanks, Jane. I'm Craig Cooper, for people who don't know me. I'm the CEO of Positive Life New South Wales. This forum, Consumer Engagement Forum, has been in the planning by the agency now for a couple of years. For people who have been around for a little bit of time, you would remember the board advisory group structure that used to be in place by Positive Life New South Wales. That was wiped out or put to one side a number of years ago. And because we're a consumer or a peer-based organisation, we've now been trying to set up another system so that the decision-making that occurs within the team, the secretariat, the paid staff within the agency, and the decision-making that occurs within the board is opened up a bit more to our members. So that's what this forum is about today. What we're planning to do is run 2 of these sessions per year on any topical or emerging issues that's going to have strategic significance to us as people living with HIV and to the work of the agency, so to the work of the body positive throughout New South Wales. So we thought, because of what's going on within the digital landscape and the e-health space, both within New South Wales and also at a Commonwealth level, and with the My Health Record coming online, we thought this was a timely moment to actually kick off the old, what was the board advisory groups, which is now being called the Consumer Engagement Forums for the board and the agency. So that's what today's session's about. You're going to have 2 people speaking, myself doing the first presentation. As a bit of a warning, on the table in front of you, there's pens and paper. Now, the pens and paper are for people who have questions about issues that are raised in my presentation, but you don't feel comfortable raising it during the presentation. The reason you may not feel comfortable raising it during the presentation is that the presentation's been recorded. The presentation's been streamed on Facebook, and it's been recorded and will be posted to YouTube. So for privacy reasons, if you're going to be asking a question that you don't want other people to hear in the broader public outside of this room, write it down on the piece of paper, and then once I finish the presentation, we'll turn off the recording and the streaming, and then you're free to actually ask any questions that you want, because we want to make sure your privacy is not breached in any way. But we also want to make sure that you're able to participate and able to have your voice in this moment, able to contribute and participate in the conversation. Now, there's a number of Positive Life board members around the room. There's about 5 board members in the room. So we're listening to you. This isn't about us just standing up here telling you what we think. We're going to be articulating a particular position and opinion, myself from Positive Life New South Wales, and we also have Vickers here from HALC, the HIV/AIDS Legal Centre. So Vickers will do a presentation after we have a conversation about my presentation, but that's sort of going to be the format. It's going to be me talking, then we're going to turn off the recording devices, and then after that, what you'll be able to do is ask any questions that you think is pertinent to you personally or pertinent to other positive people that you may know that has some questions around what digital health means, what My Health Record may mean, and what this means in e-health and your access to healthcare and the health system. So that's sort of the way we're going to be running it. This is about you asking questions and getting information and having your voice. Now, My Health Record itself at a Commonwealth level has been going for a number of years. It used to be called the Patient-Centred E-Health Record, so PECA. It was under a different act. It was called something different when it was first introduced, and back then it was an opt-in system. There were some problems and some concerns around that, and a number of years ago, after a review period and evaluation of PECA, or Patient-Centred E-Health, the Commonwealth rejigged the name on it, and then also reviewed and repealed the Act. So they made some significant changes to the Act. Overall, My Health Record is still seen as being patient-centred and patient-owned, patient-controlled in terms of how you work it. But what we'll do now is I'll go through more specifically what we see My Health Record as looking like in terms of primary use and secondary use, and then we can have a bit of a conversation around that. Does that sound okay to start off? Is it an all right way to begin?
Can I ask a question?
Yeah, sure.
I've been on this about 3 times now, really. What happens to all my data that's been there? I've got passwords and all sorts of things. It never worked.
Didn't work?
No.
So the data and the information that's currently there, because your record would be a unique record for you personally, that information would still be there.
Right.
And that would constantly, if you've already signed up to My Health Record previously, that would still be live.
Okay, that's different.
Yeah. So anytime you're getting pathology results, anytime you're getting drugs prescribed to you through the PBS or the MBS, that sort of stuff, any of those items, any activity through Medicare would automatically be uploaded into that record.
Oh, okay.
Depending on the control settings that you've set for that information, will determine which clinicians can actually view some of that information. But all the information that's currently being uploaded, everybody will be able to access that and see that in terms of your record.
So, I've got the same numbers.
Should have the same numbers in it. Okay, so what today's discussion is going to be is I'm going to talk a little bit more about what My Health Record is, the primary use of My Health Record, secondary use of My Health Record data and what the Commonwealth has been talking about and thinking through in terms of what that will look like, and some of the risks and possible impacts for people living with HIV. We're going to go outline some of the concerns for Positive Life New South Wales as an organisation, more specifically about informed consent and what we think about your health data. Ownership and control of your data and what some of the considerations or implications will be for you. Highly sensitive health information when shared and what the possible impacts will be on you. And then the commercialised and offshore use of data under the secondary use of data. Then we'll go into a summary and recommendations and a bit of a discussion about it. So what is My Health Record? So My Health Record is a national electronic record system that centralises all health information for all Australians, including people living with HIV. It's all going to be in one place. This has never happened before, unless you've been signed up for a while. But typically, our health information is kept in lots of different little places, such as a GP's clinic, such as a hospital, such as a specialist service, a specialist doctor, such as a laboratory. All of our information currently sits in different places. So this is now going to be centralising all that information into the one spot from a Commonwealth perspective. By the end of this year, the Australian Digital Health Authority will create My Health Record for everybody. For some people living with HIV, this might be useful, and it will improve health outcomes and reduce waiting times and improve efficiencies, such as polypharmacy, so some of the drug interaction stuff, some of the pathology requests that are being ordered. So if you've just been to a GP and a number of tests have been ordered, and then you go to a hospital, an emergency department, then the emergency department won't have to reorder those tests. So that's going to be some of the benefits of the advantages to having My Health Record there. Your My Health Record can include your prescriptions, your medical conditions, allergies, test results, and information from the MBS, PBS items and Medicare in terms of the last time you went to see the doctor. So it can also hold documents uploaded by your GP and hospitals and discharge summaries following care, follow-up care information. So this is basically what the primary use of My Health Record is when we're talking about primary use. So the primary use of My Health Record would be critical for some people living with HIV. It will reduce waiting times for test results, prevent duplicated tests and treatments. It will improve the coordination of healthcare to people living with HIV and improve the quality and the availability of your healthcare. Your My Health Record will have records from Medicare, PBS, MBS from the previous 2 years integrated into the record as the record goes live. So as the record is created for you this year by the Australian Digital Health Authority, what that will mean is that anything from the previous 2 years will be automatically migrated into that record. That's if you stay in the system. It is likely to reduce the incidence of adverse medical events and ensure everybody has the information they need to treat you in a responsive and timely way. So, for some people who could potentially benefit from My Health Record, people that are living with 3 or more diagnoses and see more than 2 doctors and who need to manage their own care coordination across generalist and specialist care providers. We know as we're getting older, living with HIV, and we have a number of diagnoses and conditions. I'm up to about 5 at this point in time. As that occurs, we're constantly seeing more and more doctors. And then there are issues around who's prescribing what drugs, when the appointments are, how to keep track of all of that. So it becomes more and more complicated as we're getting older, as we're living with more diagnoses. So for people like me, who has been living with HIV for 15 years or more, 20 years, 30 years in some cases for some people, and you're on more than, say, 10 pills a day, you know, and you're seeing sometimes 3 or 4 specialists as well as a GP and your HIV doctor, this will be quite important. For people who are ageing and who have had multiple hospitalisations, for people who do not have a current or previous drug and alcohol use, illicit substance use or iatrogenic dependency. So what that's talking about is that sometimes if you disclose that you've had drug using history, if you had problems with drugs or alcohol, that sort of stuff, and you're going into hospital, then the way that the doctors will respond to you and relate to you, they may sometimes, if you're saying I need more pain medication, because it's on your record that you've got drug and alcohol history as a substance user, or you've been an alcoholic in the past, that may impact on the way that they respond to you. That may also impact in terms of the way that they give you pain management in the facility. Iatrogenic addiction is typically, if you've gone through a surgical procedure, so I've had a friend recently who has had back surgery, and for 12 months after that, there was a level of dependence upon codeine products because they needed to use that codeine to manage the ongoing pain as a result of the surgery. That's typically known as iatrogenic dependency, iatrogenic addiction. And the reason that occurs is because doctors are prescribing medication as a way of helping you support your pain. So there's a bit of a hangover as a result of that. And so then you need to go through a period where you need to manage that. Having that on your record, on your health record, and how doctors and the health system then responds to that, it could be problematic. So the other issue that needs to be talked about is people who are not sexually active are in a monogamous relationship and are able to maintain viral suppression. People living with mental health concerns and diagnoses such as HAND and have memory or comprehension problems. People who are residing, working and receiving healthcare in a number of states and territories. So if you're a fly-in, fly-out worker, if you live on the border between the ACT and New South Wales or between New South Wales and Victoria. So if you're travelling around a lot and you're going into different jurisdictions to get your healthcare, sometimes My Health Record may be able to help you. Or people who take reasonable precautions and use condoms, disclosure, negotiation, PEP and PrEP as a way of making sure that you're not infecting other people with an infectious disease. These are people who potentially could benefit from My Health Record. In terms of secondary uses of My Health Record data, the primary benefits of My Health Record is likely to be undermined by the use of personal health data for any secondary purposes. We as an agency, there are some submissions on your table, and it's also available on the Positive Life website under reports and submissions. We as an agency put in a number of comments and feedback to the Commonwealth Government around the secondary use of data because of our concerns about how that would undermine the primary purpose, the primary use of the data. So even though they're saying there will be quite clear security controls put on the secondary use of the data and also it will be de-identified, we still have concerns about what that will mean and about how that potentially will undermine our trust within the health system as patients. So, some examples of any secondary purposes with or without the consent of individuals, individual record holder include benign and active surveillance of individuals and populations, linking health data across systems and passing information to law enforcement authorities, accessing your health data by insurers in the case of vehicle accident claims, accessing your health data to set insurance premiums, accessing your health data in the preparation of legal proceedings before any court or tribunal, and marketing for clinical trials and research. So risks and impacts for people living with HIV. Positive Life has concerns about the impacts of stigma, privacy and potential legal impacts or criminalisation of people living with HIV with any secondary use of My Health Record data. My Health Record can pose significant risk to people living with HIV, such as people who are sex workers, people who use drugs, illicit and illicit, women living with HIVs, immigrants and refugees living with HIV. For these people living with HIV, personal and sensitive health data could become available for secondary uses at any stage. So people living with HIV who we suggest opt out of My Health Record are people living with 2 or fewer diagnoses, only seeing 1 or 2 doctors, and who can manage their own care coordination across generalist and specialist care. People who have people who currently or have previously used drugs and alcohol, people involved in sex work, people living with a criminal history or involved in the criminal justice system, people who are sexually active and that are non-monogamous, polyamorous and single, people who receive a sexually transmitted infection diagnosis and treatment every 6 or 12 months, and people who do not practice reasonable precautions, condom use or a combination of highly active antiretroviral therapy. The opt-out sequence and timing. So the My Health Record data will occur this year. We've been told that the go live will be roughly June 2018. But they haven't completely committed at this point in time to when the go live will be. This is the opt-out sequence, which you can find on the My Health Record website, and you will be able to also give you this information if you need it later on. Explicit informed consent of My Health Record. We take the position that all health data, whether identified or unidentified, so de-identified, must be explicit and informed. We think that if they're going to be using My Health data in a de-identified way, then they should be contacting patients whose data is being used, and so that the patient can give consent around the use of that data, whether it's identified or de-identified. Now, that people may say that that could be a little bit onerous, being contacted by the Commonwealth Government to say, can we use your data for these purposes? Sure, that could be a question. The issue is, though, the principle of us having the right to know how our data is being used. And in the first instance, I'd rather people be asked than for them, by a default perspective, to be operating and saying, oh, because it's de-identified and because there's no real risk to you, the risk is minimal, then you don't really need to know that we're using your data in this way. We don't necessarily agree with that as an organisation and an agency. We think everybody should be asked in the first instance if their data and their information is going to be used. So, at the present time, there is no explicit consent for the use and disclosure of health data in My Health Record framework. The starting default setting for each record is set to open. So what that means is that you need to be vigilant as if you decide to stay in, you need to go into your health record on a regular basis, and you need to change the settings on all the data that goes into that record. If you don't want particular doctors and particular people in the system to actually see the different pieces of information that are being uploaded into your record, you're going to have to log in on a regular basis to moderate and manage how those records are being viewed by different service providers and clinicians. Your health record providers will upload information about you unless you have specifically asked your provider not to upload a particular document. The range of providers who have access to your information is extremely broad and includes contractors who provide services to doctors and the Australian Digital Health Agency, for example, IT companies and contractors. Ownership and control of your My Health Record data. We take a position that your health data remains permanently owned by you and under your authority and control. At the moment, even though you have quite a lot of control of the data within the system, once the data is there, it cannot be deleted. You can change the settings on how the data is viewed or who can view the data, but once the data is uploaded, it is permanently there. So, even though you have control as a patient of the record, the system owns the record. Research and commercial companies could put precedence over the interests of health consumers when the activity is seen to be for the public good or in the public interest. So what that means is, even though the data is there, if they can argue or explain that the data is going to be used for the public good, then that will say they're able to control and access your information. There is no oversight or independent accountability framework protecting the interests of health consumers, for example, data protection legislation at the moment in Australia. There is no public register dealing with organisations or individuals' requests including purpose, nature and status of data for secondary use. That's all yet to be finalised and determined. Highly sensitive health information and My Health Record. We believe the access to and sharing of highly sensitive people living with HIV health information by government and private entities is of significant and great concern. At the present time, information can be passed to authorities to aid an investigation even with no evidence of a crime. Information can be passed to authorities if it is suspected a crime has been committed. Secondary use of your health data is very broad and includes direct marketing by commercial entities. If you share information with your doctor in a confidential setting to get treatment, even if your doctor has no intention to report use, authorities will have access to this information, and computer programmers can make decisions with the full authorisation as if they were decision made by a human being, e.g. robocalls and Centrelink depths. So people living with HIV and My Health Record, we believe each individual health record should start with the highest restrictive privacy setting level, even at the highest level of restriction that has been set previously. Every document that is uploaded is automatically set to open. All people living with HIV must be fully informed about what personal health information could become available to researchers and other third parties. People must be able to completely delete sections of their own record if they wish. The effective delete removes the files from view, but it is forever on the system linked to your account. Questions remain as to the retrievable, viewable nature of the file depending on who logs in and views the account. People must be notified every time any part of your health data is passed on or linked for research or commercial interests. So, recommendations and support. If you share any of the concerns that Positive Life has actually presented today, as we suggest people living with HIV opt out of My Health Record, so what we do is we're suggesting that all people opt out of My Health Record if you share our concerns until your concerns are allayed, until these issues are resolved with the Commonwealth. By June 2018, Positive Life will provide step-by-step instructions and resources on how to opt out. similar to what you've seen already. People living with HIV in the Nepean Blue Mountains area already have been signed up to My Health Record as a part of the opt-out trial, and Positive Life will be offering step-by-step resources on how you can cancel, restrict and modify your record. For people living with hand or with limited access to a computer, Positive Life staff will be able to assist you in the opt-out process. So what we're saying is you should opt out if you have any concerns around the information like we've been saying today. For people who have already opted in and you're needing further support, we can help you to do that. And if people are not used to using computers or are confused about how this actually works, and because of you're not computer literate, or you have some mental health issues going on, some anxiety issues or hand, then let us know and we'll help you how to manage the system. In terms of linking things and linking up what's going on in the My Health Record space and what this means, basically our concerns are HIV criminalisation, both at a jurisdictional and so within New South Wales and also at a national level. We've had ongoing concerns for years now around HIV criminalisation, and the concern is that this type of system, the way that the legislation reads at this point in time and the way that the system operates, the concerns are that people living with HIV will become more criminalised. The changes to the New South Wales Public Health Act, in particular Section 79, which Vickers will talk to shortly from HALC, those changes in terms of reasonable precautions and whether people are practising reasonable precautions, and the penalties that now apply within Section 79 of the Public Health Act relates to this. Even though these are separate pieces of legislation and separate systems, they still are going to be relating to one another in one way or another. So that's it for me. Are there any questions that you want to ask now? Otherwise, we'll switch off the recording and the streaming and we can have a bit of a discussion about what we've just talked about.